The primary purpose of the Continuing Competence Program is to promote quality assurance with respect to the practice of social work and social service work, and to encourage members to enhance their practice in an ongoing way. This is one way the College fulfills its mandate of protecting the public. The CCP was approved by Council in 2009 and is now in effect. All members are required to participate. For ease of reference, the Continuing Competence Program is referred to as the CCP. This presentation will cover the legislative context of the CCP, background information regarding the development of the CCP, a description of the program components, and what to do if you have further questions. It's important to understand where the CCP fits with the College's responsibility to protect the public interest. The College's key regulatory authority comes from the Social Work and Social Service Work Act. The Act clearly states the mandate of the College is to serve and protect the public interest. The Act also outlines a number of objects, two of which are particularly relevant to the CCP. They are to establish and enforce professional standards and ethical standards, and to promote high standards and quality assurance with respect to social work and social service work. The registration regulation made under the Social Work and Social Service Work Act states that members must provide evidence of their continuing competence to practice social work or social service work in accordance with the guidelines approved by Council. The Professional Misconduct Regulation also stipulates that it's an act of professional misconduct to contravene the Act, its regulations, or bylaws. In keeping with the Act, the regulation and the bylaws, the CCP has a number of purposes: to promote quality assurance with respect to social work and social service work practice, to encourage members to enhance their practice in an ongoing way, and to encourage members to strive for excellence in their practice. It doesn't matter if you're a new graduate or have years of experience. Learning is lifelong, and practice can always be enhanced. Before developing the CCP, the College conducted research to learn about the continuing competence programs, or quality assurance programs as they're sometimes called, for social work regulatory bodies in the US and Canada, and health regulatory bodies in Ontario. These included nurses, psychologists, and occupational therapists. Based on this research, a CCP model was developed and approved in principle by the College Council. Extensive consultation then took place with members who provided valuable feedback which was used to improve the CCP. The CCP was finalized and launched in the spring of 2009. The College considered various models in developing the CCP. One model, used by some regulatory bodies, is a continuing education model, where the member collects hours or credits by engaging in professional development activities, such as attending workshops or conferences. There are, however, drawbacks to this model. For example, there's a lack of evidence that demonstrates that simply by attending educational events, a member's professional practice improves. In addition, participation in this kind of program may be easier for those who live in larger urban centers and have better access to professional development activities. The College wanted to ensure that all members, regardless of location or resources, would find the program accessible. So, as is the case with many of the health professionals in Ontario, the College adopted a self-directed adult education model for its CCP. This model requires members to conduct an annual review of their practice, identify areas of strength and areas requiring improvement or new learning, set learning goals and objectives, identify learning activities to meet the goals, engage in the learning activities, review and record the outcome of the learning activities, and make an annual declaration to the College of their participation in the program. A number of guiding principles were applied in the development of the CCP. The program is intended to be meaningful, That is, the professional development plan is created by you to meet your learning needs. The program is intended to be feasible and accessible for all members, regardless of their location or circumstance. Finally, the program was designed to be cost-effective, both for members and for the college in administering the program. These principles were at the forefront of the planning and development of the program, and are especially important as all members, regardless of work status, are required to participate in the program. There are two CCP documents. The first is the instruction guide. The guide includes a summary and explanation of the steps involved in the CCP, frequently asked questions, and examples of learning activities. The second document, the self-assessment tool and professional development plan, must be completed each year and retained for a minimum of 7 years. Members are also encouraged to retain their instruction guide to use in future years. The CCP documents, along with any evidence of participation in the CCP, can be stored in the member resource binder the college provided to all members. The two CCP documents are also found on the college website. The self-assessment tool and professional development plan can be completed electronically and saved to your computer for future reference and updates. As a first step in completing the CCP, members are encouraged to become familiar with the program by reviewing the instruction guide, which outlines the steps involved and includes frequently asked questions and examples of learning activities. The next step is to review your practice and complete the self-assessment tool. It may be helpful to start with a review of your current professional responsibilities, evaluating your areas of strength and areas for improvement or new learning. You may also find it helpful to consider any recent practice dilemmas you encountered and how they might inform your learning goals. You may wish to consult with a colleague or supervisor, as an objective third party's view could be helpful. You will also find an optional worksheet which you may find useful. It will be necessary to review the standards of practice before completing the self-assessment tool. All members have been provided with a copy of the Code of Ethics and Standards of Practice Handbook. It's also on the college website for easy access. Members are reminded that the standards of practice are applicable to all members, whether they're engaged in clinical or non-clinical, direct or indirect practice. For more information on the types of practice, please refer to the explanatory note in the Code of Ethics and Standards of Practice Handbook. The next step in the program is to identify learning goals. Remember, a goal is not required for all 8 principles in the standards of practice. However, you are required to review and comment on each of the principles. It's also important to note that some goals relate to more than one principle. The next step is to develop SMART learning objectives that relate to your learning goals. SMART learning objectives are specific, measurable, attainable, realistic, and timely. In developing SMART learning objectives, it may be helpful to answer the following questions. What do you want to accomplish? How will you accomplish it? How will you measure your accomplishment? In other words, what evidence will you have that learning has taken place? You're now ready to identify the learning activities you will engage in to reach your goal and objectives. A learning activity must relate to an identified goal and objective and to the practice of social work or social service work. You'll find a list of examples of learning activities in the instruction guide. You'll notice they're very broadly defined. Not only conferences and workshops, but also such things as independent study, peer supervision, or preparing an article for publication are considered learning activities. This recognizes that people have different learning styles and also ensures that learning is accessible for all members, even those who live in more remote areas and are unable to attend conferences. The next step is to determine the evidence of accomplishing your goals and objectives, and the date by which you'll accomplish them. How will you know you've met your goal? What will you know or be able to do? What's your target date? It's important to be specific. You're now ready to implement your learning plan by engaging in the learning activities you've identified. It's a good idea to periodically review your progress to ensure your learning is on track. You can record objectives that have been met or your progress for those that have been partially met. You may add new goals or unanticipated learning or make any necessary adjustments to your learning plan. At the time of annual renewal, you'll be required to make a declaration to the college that you're participating in the CCP, that you've completed the self-assessment tool and professional development plan, and have carried out learning activities to reach your goals. It's not expected that you'll necessarily have met all your objectives, as learning is ongoing. However, your learning activities should be well underway, and at least some of your objectives should have been met. Each year, you'll be required to complete a new professional development plan, though some goals and learning activities may carry over from one year to the next. You're required to retain your materials for a minimum of 7 years, but are not required to submit them to the college unless they're requested. Here are a number of suggestions if you still have questions. Look back at the frequently asked questions in the instruction guide or consult the college website for updates. The prospective newsletter contains articles about the CCP. It's sent to all members and is also on the website. Finally, you may wish to consult with a staff member in the Professional Practice Department by calling our toll-free number, 1-877-828-9380, or email at ccp@OCSWSSW.org. We hope you've found this presentation helpful in understanding the Continuing Competence Program and its requirements.